So today's topic is Drosera rotundifolia, that is Sondrew common name. We will discuss about the cough of a Drosera, that is character of the cough is first we will discuss, that is whooping cough. Mostly whooping cough means what? That is the paroxysm. It is having a paroxysm and so that the patient does not breathe. And the whooping cough is a siege with large quantity of when tenacious large quantity of mucus is raised, then that cough will be does not siege up to the tenacious mucus, means the ending of the cough will be occur by expectoration of the tenacious large quantity of mucus. Is what that you should remember by this, that the bracket in the allen it is written that the minute gone like a violent cough in during day. This is the type of a Drosera cough. Minute gone like violent cough means what? The cough will be on small cough interval. Cough will be occur, but at night there will be whooping cough will be more. That's why it is compare with coccus cacti, and in coccus cacti there will be epistaxis or a nose bleeding occur during the coughing period or coughing paroxysmal. So you should compare these things with a corallium rubrum and cactus recti. Then the timing of a whooping cough mainly at night. High CMS also the cough will at night, that's why it's compare. And in rheumix there will be the cough is starting with a small tickling sensation. Then what is rheumix cough? Tickling cough, that is the throat region, but belladonna having violent cough, that's why it is compared. That timing of a night, at night whooping cough, that is hysemus, rheumix, drosera, belladonna violent cough. Then in children the cough will be constant tilting cough. The cough started as soon as the child head touched the pillow. So, but in young people, the cough will be there will be cough is night cough with bloody purulent sputum. Okay, that is the important. In children, there will be no bloody like, but the children peculiar thing has that the child who as soon as he touch the touch or lying down or touch the pillow, the cough will be started more aggressive, and there will be sensation, fever like sensation in the larynx. So character of the cough we will discuss, the child and the young you should compare this, and the sensation of a cough we will discuss. Then character of the cough is also compare with the cuprum. Why? Because in cuprum there also be gagging, vomiting, but there will be important marking point is that there will be cold water by by drinking cold water, the amylation of a whooping cough will be ameliorated, and that is the marking point of a cuprum. But here the cough is that water vomiting, mucus containing somewhere, bleeding from nose and mouth. Okay, bleeding from nose and mouth, constriction of a larynx leads to hoarseness, and the sputum which is calm, that is yellowish greenish sputum. Itching and vomiting also occur in the brownie and calicar. In calicar there will be the vomiting occur, but that is not so well marked. Brownie also gagging and vomiting is present, that's why the bracket brownie and calicar. There will be the cough is a deep sounding hoarse barking cough. Barking cough also here present. But clinically if we go, that important point you should remember that when you go for clinically condition, which I take all this stuff that to understand the Drosera cough, but the clinically two major point is important, that is cough is always aggravated when lying down. Patient says that whenever he go for bed, the cough is get more worsen. That is the important point, key point of the Drosera. And the cough is also aggravated by warmth, drinking, singing after midnight. Okay, these things are occur during and before measles. That is the important, and it is also given in laryngeal pertussis and endemic pertussis. Means somewhere, some area the cough is prevalent at that area, that is called endemic pertussis. Nowadays it is not found, but why I shall discuss all these lesson, because you should remember that this is important for your exam. But for